so. I don't think the federal government has done enough to address the issue of inappropriate transfers of funds for several years, even as reports indicate that our nation's government-run systems needlessly waste hundreds of billions of dollars each year through these activities. So eliminating the problems that cause the hemorrhage of billions of dollars in our country's government-run healthcare programs should have been a priority actually before we began to think about expanding the role of the federal government in healthcare, but we didn't do that. Fraud analysts and law enforcement officials that estimate that 10% of the total healthcare expenditures are lost to fraud on an annual basis. If we are serious about bringing down the cost of healthcare and protecting the patient, but not just reducing but eliminating fraud is where we need to go. In Medicare, the government pays providers in practically an automatic fashion without review or scrutiny of the claims submitted. In North Texas, Fox 4, Channel 4, Becky Oliver, an investigative reporter, reported on a home health agency operator who's now behind bars. The records show that Medicare paid her over $8 million in 2 years' time to care for homebound patients. The woman's patients included a man seen moving furniture, a lady seen running errands, and a man seen enjoying barbecue. Even worse than that, she had multiple provider numbers, and after they shut down one provider number, they continued to pay other provider numbers to the same post office box. This is unacceptable. Currently, the Center for Medicare and Medicaid Services oversees a network of private contractors that conduct various program integrity activities in conjunction with the Office of Inspector General at Health and Human Services and the Department of Justice, yet we're still losing billions of dollars annually to fraud. We must improve oversight of these contractors, and the Center for Medicare and Medicaid Services needs to take a more proactive role in assuring that contractors are using the utmost scrutiny in reviewing their activities. Further, I will raise a point that I've raised numerous times. How much fraud are we willing to tolerate? And the answer should be none, but in reality, the lack of prosecutors with a background in health law cripples our ability to go after everyone, or in fact, anyone. Are we comfortable with that? And if not, this committee should work with our colleagues in judiciary to correct it. Under the Patient Protection and Affordable Care Act, and I would submit that affordable should be stricken from the title, but our current system is to prevent improper payments, and we know it's inadequate. How can you assure that millions of dollars in funding in the PPACA and the Reconciliation Act will solve the problem? If more needs to be done, and it does, it should be a priority in this committee. I have introduced several fraud-fighting amendments during the consideration of our healthcare bill 3200. As a ranking member of Oversight and Investigations, I'm working with Ranking Member Barton to build off these suggestions for forthcoming legislation. As healthcare expenditures continue to rise, developing new and innovative approaches to fight fraud become increasingly important, and I look forward to the testimony of our colleagues today, as well as the representatives of the federal agencies, and I'll yield back.
Thank you, Mr. Burgess.